do you have a story of either personal experience or something you heard where a healthcare leader, IT leader in particular, used storytelling to really make a difference?
Having worked in the space so long and
Mm.
helping craft literal categories in the space through storytelling, there are thousands of stories I've had the opportunity to tell. But I have to say that some of my favorite stories kind of are very clear on what the pain points are in healthcare. They are centered around people and that there's a real purpose, right? And so some of my favorite stories happened during COVID. One of my favorite stories was and sad, was a mother meeting her twins for the first time through telehealth
Mhm.
because it was during the pandemic and there was an outbreak and she had COVID. And being able to tell that story was not just about telling her story. It was also a piece of advocacy work. And then at the time, reimbursement models were not happening for virtual care, right? They were just not, but it was a critical part of what needed to happen moving forward. And so telling her story, it was about more than the story. The story was impactful and beautiful and sad and sensational, but it was also purposeful. Those are the types of stories I'd love healthcare to tell more of. They're touching, they're life changing. But it's funny because that was a sensational, very personal people story, right? Innovation story that helped make change, right? A lot of those stories built together made change in that reimbursement model side of the house and we were able to help move things forward. That's an ongoing process. That's still happening. We're trying to tell as many stories as possible to keep those regulations changing so that there's more reimbursement in that space. But other stories that we've told in the past 15 years are these small, tiny stories that you think are tiny. I saved
Mhm.
5 minutes at the bedside, right? I had less clicks in the EHR. All these small stories build up over time and develop real change. And so that's been exciting to see that sometimes the best storytelling is not sensational and is not beautiful and it doesn't make you cry, but it's authentic. And so I think that healthcare leaders, when you're thinking about your own story, how can you be authentic? And how can you be purposeful? And how can you bring in that human element while also staying true to what matters to you? Because what matters to you matters to the industry. So it's a mixture of the two. It's not
Mhm.
just those exciting, fun, tearjerker stories, it's also those day to day stories that make a long term impact.